everyone to today's webinar, Enabling a Tech-Centric, Data-Driven Healthcare Workforce Strategy. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll start today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded, and it will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Also, if at any time you don't see your slides moving or you're having trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. Thank you all so much for being here. Patrick, I'll now turn the floor over to you to get us started.
Great, thank you, Randy. Hi, everybody. My name is Pat McCall. I'm the Chief Growth Officer at AMN Healthcare, and I'm pleased to be joining you today. And also with me today, I have Christine Keithley, the Associate Chief Nursing Officer and Vice President of Patient Care Services at Bayhealth. Prior to her current role, she was the Vice President for Nursing Administration and Operations at Tower Health, where she led the integration of nursing, strategic, and financial planning across the system, including setting direction for a responsive nursing workforce plan, as well as overseeing patient care systems and models, the nursing talent pipeline, recruitment and retention, and nursing leader development. She also led workforce optimization programs across the health system using predictive analytics to create nurse staffing models. And her work enabled nursing to reduce the need for reassignment and reduce the total number of nursing labor expense. I also have Jonna Smith joining me today. For the past 7 years, she has served as the Chief Nursing Executive at St. Joseph Memorial Hospital in Murfreesboro, Illinois. This is a 25-bed critical access hospital that is a part of the Southern Illinois healthcare system. She has been leading change within the organization by driving operational excellence, fostering a culture of patient-centered care, and implementing innovative solutions to enhance healthcare delivery. So I'm excited to have you both share your experiences a little bit. And I'll go ahead and kick off with some contextual information. So if we think about the healthcare space today, we're really at a pivotal moment, and we're facing a number of challenges and also have a number of opportunities as well. So you can see that there's a lot of financial stress on health systems. Fortunately, in some cases, this is improving, but you can see that we've had a dramatic increase in overall expenses. And this has, of course, created a lot of pressure on operating margins in health systems. And of course, workforce challenges. This is the #1 reported concern for hospital CEOs in 2023, and this has been pretty persistent through the pandemic up to the present day. So, then you start asking yourself, well, what do you do about these things? And of course, you do have a need for actionable talent acquisition and retention, and the data that supports that. So, health systems, they've either had master supplier or vendor neutral MSPs, so they're looking for more flexible workforce options. And 73% of nurses, I thought this was an interesting statistic, said implementing flexible scheduling would significantly reduce stress. So that's a pretty impactful statistic from our latest nursing leader survey. And then, as I alluded to earlier, moving away from either or solutions. So some of the old binaries are dead, meaning the difference between master vendor and vendor neutral, and really looking more at hybrid models. So the shifts in demographics and market forces, including evolving patient needs and technological advancements, really demand a more transformative approach to workforce management. So if we think about some of the things that are really driving this, so if we were going to characterize the problem, certainly we see that long-term strategies for financial stability, we see a lot more addressing near-term financial struggles. And healthcare organizations, they struggle with operational costs and emphasizing the need for effective cost management. But you also see that a lot of the current talent programs and MSPs focus on bill rate reductions. And really, the focus is less on an optimized delivery model and then utilization management as well. So we also see that there's an inability to tackle persistent talent acquisition and retention challenges. So healthcare faces pretty significant shortages in nurses and physicians alongside challenges in talent acquisition and retention as well. And a lot of the solutions today, the MSP solutions today, really have more of a singular focus on filling contingent roles quickly, and they don't really address some of those deeper workforce challenges. Another part or dimension of the problem is really not harnessing technology and innovation for workforce empowerment. So healthcare executives are prioritizing strategic investments in technology, but the MSPs themselves lag in adopting advanced workforce technology. And I think finally, I'd say there's been we've been slow to deliver transparency and adapt to evolving sourcing models in the space in general. And MSPs themselves have been slow to adopt some of these evolving models. And you know, I alluded to hybrid earlier, and that's led to challenges in transparency and flexibility. So if we think about what is the solution, obviously there's no singular solution, but as we think about the solution to a lot of these problems and addressing these problems, it's really thinking about a more evolved MSP solution or talent program solution. And if you see there, basically at the bottom, you have talent planning, acquisition, and deployment. And you know, when I talk about talent planning, that involves strategically accessing all forms of talent engagement and developing proactive approaches to hiring needs. When we're talking about talent acquisition, we're basically saying the integration of various workforce technologies and services to offer maximum flexibility in our staffing models. And then for talent deployment, that's utilizing cutting edge technology to optimize staffing management and enhance operational efficiency and, of course, the patient experience and their satisfaction. So those are sort of underpinning things, but then you think about the VMS technology and other workforce technologies, and then core MSP processes. And the way I like to think about this is these are the things that somebody has to do, whether it's the MSP or the client if they insource the program themselves. But these are the core processes of a talent program like an MSP. The big decision point for organizations is thinking about, well, what's the right sourcing strategy to put on top of those core processes? And the sourcing strategy is driven by a number of things, certainly externalities such as the macro talent environment, but also your current mix modeling inside of your healthcare organization and some of the goals that you have in terms of generating leverage off of your spend, generating transparency. So all of these objectives figure into the calibration of the model that you want. And you know, if you think about the difference between vendor neutral and master, there's a lot of real estate here. It's pretty proportional on the slide, but there's a lot of real estate in between those two logical extremes. And that's what we mean by hybrid. It's really anything that takes maybe some of the concepts that you see in neutral and in master supplier models and combines those in a more calibrated, prescriptive fashion for the health system. So what this requires is for us to think about how we're more prescriptive, how we retire some of the old binary approaches of either or, and we get a lot more calibrated in our approach. So I am going to turn this over now to Christine, who's going to talk a little bit about her personal experience in her health system. And Christine, I'll go ahead and cede the floor to you.
Okay, thanks, Pat, and good afternoon, everyone. I was going to start off by talking about really that holistic approach to workforce. Really 7 items that I wanted to discuss falling under there. First would be planning and recruitment of your staff, looking at your current needs, but also looking at your future needs and based on your patient demand. Professional development, just an organization that provides continuous learning so that your staff that you are currently working can learn and grow in that same atmosphere, supporting certifications and nursing education, and then also supporting leadership education. Another part of that would be supporting well-being and mental health. Is a highly stressful environment working in a hospital system, promoting work-life balance and including flexible schedules in that work-life balance. Hospitals are a 24/7, entity. It's not the same as when you have staff that are working 9 to 5. There's specific needs for nurses, and they want to optimize, their schedules as much as they can. We look at all types of different things underneath there, which we'll discuss a little bit later on. So leadership, another part of a holistic workforce is effective leadership, making sure that our leaders have the information they need, that they're really, I think, probably groundbreaking in retention and recruitment on that unit, making sure that the leader has the same type of culture and is supportive style. They encourage open communication. They encourage really using the shared governance decision-making model and recognition of staff. And then career pathways and advancement. This has been something we've used in recruiting, kind of putting a career pathway together for a new grad. Maybe when they come in, they start in a med-surg unit. It's not really where they want to land, but it lays the foundation for them. And then they have a career pathway that's worked out. At 8 months, they're going to start shadowing on an ICU unit or in an ED or whatever unit it might be. And then they'll move along that career pathway that they've set out for themselves. We also have something for those who aren't really sure what they want to do when they, get on the nursing floor. So they might start out in a new med-surg area, but then they get an opportunity to shadow in several different specialties. So they can kind of work out where they want to be and, work towards what are the needs that I have in my career to get to where I want to be. And then also, I think fostering a positive workforce culture, promoting collaboration and respect among your employees, among nurses, make sure they have a sense of family on the unit they're on, that they have the mentors they need, that their preceptor is experienced and understands what they need to get themselves going post-orientation as well. And then it's your technology and resources. And, really technology has become a skill that nurses and healthcare workers have to have as part of their job description. So they want the tools they need to do their job, and then continuous evaluation and feedback, because things that worked last year might not work again. If you haven't done a reevaluation of your staffing approach since prior to COVID, the time is now. Things are changing now, and it's a different workforce out there. So for recruiting and retention of nurses, really, it's nurses are crucial to maintaining patient quality care. They're the backbone of patient care. And 2 of the biggest dissatisfiers I hear again and again from nurses are, what's the RN to patient ratio? It's too high on my unit, and I'm getting pulled, I'm getting floated out every other shift. It's not what I signed up for. So you really need to mitigate those 2 things in order to retain your nurses. And you really have to have the right data to do that. So you need to have your vacancy and turnover rate, not just across the board, but at the unit level. It's possible that you may have a vacancy rate of 15%, but you have pockets of units that may have greater than 50%, and that causes nurses to get pulled. It causes short staffing. It increases your RN to patient ratios on those units. And if that's happening, you really need to mitigate that as soon as you can. I think recruiting really needs to be specific and targeted to the areas that it's needed most. So, every unit probably has med-surg. If you have 5 med-surg units, they all have needs, but the one with the greatest vacancy rate, maybe you need to work something out with that unit to make it more attractive to the new grads that are coming in. Even if you can get some experienced staff, it's been more difficult recently getting experienced staff, but making sure that you meet their needs where they are. And then providing a culture where, it allows them to grow. They have a residency program coming in. They have the mentors they need, that their unit is supporting them, even if they know they're not going to be there for 4 years or 2 years. If your unit is a stepping stone to move to a higher level of care, just supporting that where it is, and making sure that you're feeding that unit every time so that the vacancy rate and the turnover doesn't get out of control. So I really like looking at data metrics. I really like working with the workforce dashboard. It allows for opportunities for organizations to understand what's working well and what's not. It can tell you what your cost of premium labor are, how much overtime and bonus you're using, how many one-to-one sitters. In real time, that information is right there. At my previous organization, we had a steering committee, which was really staffing and labor, and I had a dashboard that we worked with our MSP provider, and it was great to have that. I didn't spend hours every week getting ready for this meeting to share with our executive team what we had, what we needed. It was all right there, and it was in real time. And you could filter down and look at unit level, you could look at hospital level, you could look at system level. So all of that was great information to have available in an instant when you needed it. The other thing is centralizing your processes. Really, a centralized staffing office is needed to do that. You really need to look at across the system or across your hospital what's happening, making sure that you're using the right labor at the right time, that you don't have units that are canceling staff while other units are using overtime and bonus and travelers at the same time. So if you want to eliminate efficiencies in the processes, you really need that one kind of source that's going to manage all of those processes that come out of there. They also, manage staffing coming in and out, people calling out, making sure that the information is getting placed into your, whether it's your scheduling system or your payroll system in real time. So that's helpful too. As far as advancing technology, our software is available to do a lot of things. And one of my pet peeves is not using all of the features of your software that's out there. So at this point, everybody should be self-scheduling. There should be no longer having paper nursing schedules, that we're using. Our staff, we got to make it easy for them. They're working all the time. They're busy. There's not a lot of downtime for them to do things. So if they can use a program that's available on an app, get in from home, kind of look at their calendar, make sure they schedule what they need to. You also can use that technology to create consistency. And that's important when you're, scheduling processes so that it's fair across the board, that, your PRN staff aren't getting every Tuesday, Wednesday, Thursday, that we kind of are sharing the shifts that are more attractive and not so attractive, but making sure your full-time and part-time staff, your core staff, are utilized where they need to be, and then your contingent staff should fill in all the extra shifts that might be available. Making sure that your scheduling system works well with your payroll system if it's not the same system. Having your EMR integrate seamlessly with your scheduling system as well is really important. Another thing is partnering with organizations that understand the mission, vision, and values of your current organization. They understand your needs. They can provide you with solutions. They're not just putting a package together that they give to everybody out there. It's really specific to the needs of your organization. You want to make sure the solutions are a good fit, and you want to make sure that they're listening to you and that you have open communication, looking at your MSP provider and what are your needs, what units are using the most travelers or agency staff, and how can I mitigate that? Making sure that I'm staying within budget is really important too, understanding a budget, a nursing budget, and what the workforce looks like. And that escalating request that you have that might be a priority is very important as well. So at this point, I'm going to turn it over to John Smith from Southern Illinois Healthcare, and she's going to talk about things that have happened at her organization.
Thanks, Christine. Good afternoon, everyone. I'm excited to share a little bit of information about our journey here at Southern Illinois Healthcare. The data can speak for itself. I think it's more impactful for me to just talk through our story of how we got to where we are. So I remember in 2022 sitting in a conference room with fellow nurse executives and some directors, and much like many other nursing leaders across the nation at that time, we were all trying to think about what can we do to staff our departments, because many of our nurses had left to join the travel agencies, and the supply to demand ratio was far off. We were really frustrated at the point where we were with our contingent labor and our current partner that we were utilizing for our contingent labor. So someone just asked the question, like, are we doing the definition of insanity, and should we look for other resources that can help supplement us? So I had been on a previous Becker's webinar and had seen a presentation from Temple Health, and it kind of sparked my interest that our organization really needed a workforce analysis. At the time, we didn't know that's what it was, but we really did. We did need that, but we also needed to look at what we were doing with our contingent labor and supplementing at that time. So as previously mentioned by Christine, like, technology is our friend, and that's really what we need to use. Transparency is so important, especially when it comes to contingent labor. It's a huge cost to our organization, and we did not have that level of transparency. We did not have the data. We didn't have the number of applicants that we needed to fill our positions. So not just in nursing, but in our ancillary departments too. Just a lot of frustration and feeling that we were each day, again, trying to figure out a way to staff our departments and staff, imaging, radiology, respiratory, and we were just spinning our wheels. So again, we had a lot of challenges. As Christine mentioned, finding someone that can meet you where you're at, and a true partner. And that's really what we were looking for, somebody that we could partner with and help us in a time where we needed to supplement our staffing. But we also know we needed to reduce cost, and every business is in it to make money, but we really needed that level of transparency that we're able to have now. And so again, we've been able to reduce our bill rates, and we're seeing positions filled quicker than we've ever seen them filled before. And the number of applicants that we're getting at this point in time, and even in 2023, where we felt like we had more of a choice to be able to choose candidates. It seemed like, we would have, 20 positions we needed filled, and we may receive 2 applicants for those 20 positions. So this definitely has put our organization in a better place and a better partnership with our MSP. Now I'll turn it back over to you, Pat.
Thank you, Jonna. I appreciate it. I appreciate you both sharing the insights that you have with the audience today. I think if we think about the outcomes that we hope to generate in a lot of these environments, you can think about it in sort of 5 quick bullet points. But financial optimization, effectively what we mean there is the reduction of operational costs and ensuring financial sustainability. I think the the key thing there is not only attacking bill rates, but also utilization in the broader context of a dynamic workforce plan. And if we think about enhanced talent acquisition and retention, essentially we want to retain our top talent and we want to reduce turnover rates. And so understanding that those have had some impact, and we've seen greater turnover here, especially post-pandemic. So that's certainly something that we want to focus on and an outcome that we want to produce. Obviously, operational efficiency. So we want to be much more streamlined and more productive and have the ability to measure that discreetly. With technological innovation, so we do want with our programs, one of the advantages, of course, is that you can stay ahead of a lot of the developments in the space, the innovation in the space, and provide rich data analytics. One of the things that obviously we've seen is AI, and generative AI in particular has burst on the scene in the last 12 to 18 months. And this provides opportunities, but it also makes the picture even more and more complex. And then strategic risk management. So we're not only mitigating risk with market fluctuations up and down, which that is going to occur. That's a part of the dynamic nature of this business, but also a lot of the regulatory changes and how those affect your operations and how you thoughtfully integrate those changes into your operations. So with that said, I think I'm going to turn it back over to Randy to manage the Q&A, and I do see that we've had a number of questions come in. So Randy, I'll turn it back over to you.
Thanks, Pat, and thank you all for the great presentation. We're going to start today's question and answer session. As a reminder, please submit any questions you have by typing them into the Q&A chat on your webinar console. So for the first question, Pat, I'll go to you. How does your hybrid MSP model differ from traditional MSP approaches? What benefits does it offer in terms of long-term financial stability?
Yeah, I don't know that I would characterize it as being different from traditional approaches. I think it's a little bit different from maybe what we've seen inside of healthcare. Outside of healthcare, you've seen much more of a migration away from maybe some of the brittle extremes in master supplier and vendor neutral into a more calibrated approach, as I alluded to earlier. So this is utilization of the things that address specific business and operational needs in terms of the sourcing strategy. So the way I like to think of an MSP is that it's an umbrella, and based on the category of labor, the location, that drives some of the nuance around the sourcing strategy itself. So if you think about a hybrid program, it could include neutral concepts, master supplier concepts. You could be utilizing things like EOR, payroll, float pool, internal agency, direct sourcing. So a lot of different sourcing model modalities that would plug into the MSP model. So again, I think it may have been Christina mentioned, meeting people where they are. That is really important. So it's not coming with a preset model or a preconceived notion of how this ought to look, and it's much more driven by the prescriptive needs of the organization.
Mm-hmm. Thank you so much. And speaking of Christine, this next question I'm going to throw your way. How have you leveraged the data from technology to implement and execute on your workforce strategies?
Christine, I think you might be muted. Apologies.
Thank you. So thanks for that question. One thing that we did was we utilized data from our admissions and discharges, through our EMR, and created heat maps for each unit. So it had all of the information across the days of the week with admission, discharges, census, and then really where your areas of churn were. And then we matched that up with staffing plans for those units, so that staffing wasn't flat across. Every unit didn't need, if you had a 30-bed unit, you didn't get 6 nurses and 3 CNAs. It was based on at what time of the day and what day of the week are you really using the staff, or where do you really need the staff? So, on a surgical floor, the weekends, they didn't need as much staff. And almost every unit was seeing a lot of churn between 3 p.m. and 8 p.m. So we were able to come up with some innovative ways to put together their staffing plan, whether it was a churn nurse for that unit. We came up with using virtual nurses to do admissions and discharges to kind of alleviate some of the extra, I would say, work that was going on during those times of the day. So I think that was one way that was very successful in creating really staffing grids that matched patient demand.
Thank you so much. And then, Jonna, this next one will be for you. What were the key decision factors evaluated prior to making a transition to a vendor-neutral program? What advice do you have for other hospitals considering implementing a similar VMS solution?
Yeah, I think for us, it was truly about a partnership. We needed a partner for the journey that we were on at that time and moving forward, and transparency. So those were 2 of our must-haves. I think my advice for other organizations, if they're looking into something, is speak to several different places and see what's going to fit for you. Make sure that they can meet you where, like Christine said, meet you where you are, and they're not just trying to come in and do a one-size-fits-all model for you, because it won't work. And I always love to reach out to other organizations that have implemented and said, tell me the pros and the cons. Like, they already have a relationship with that vendor, and they can, they're sometimes your best salespeople, or they'll steer you in a different direction because they've learned that. So that would be my advice.
Thank you. Great advice. And speaking of that one-size-fits-all, Pat, how do you make sure that your solutions are adaptable to the evolving needs and challenges of healthcare organizations?
Pat, I think you're muted this time.
Now I'm muted. So sorry about that. I think I would answer that 2 ways. Certainly one way is for a deployed program solution that we have. So a live program, if you will. That requires, you need to baseline with the understanding that your client's needs are going to be dynamic, and you're going to need to continue to evolve the relationship and the sourcing modalities that you use depending on the external factors and some of the objectives that they have for their organization, whether they have a workforce model that requires some adjustment, whether they want to generate leverage off of their spend. As Jonna mentioned, greater transparency and control. So you want to calibrate the program that way. As it relates to our solutions, the discrete solutions that we have, some of these software offerings, we are constantly taking in input from practitioners and clinicians who can give us real world practical understanding of how our tools are utilized and how they'd like to be utilizing our tools in the future. So, that kind of input and having a really robust input process is important to continuing to update our tools and applications. The other, of course, is staying abreast of all the regulatory changes that occur, and this is a really fluid environment, so we have to ensure that our solutions are fully compliant as well.
Mm-hmm. I see. And then I know you talked a bit about AI earlier. Can you touch on a little more about how AI helps with scheduling and/or audio?
Yeah. So we absolutely have a tool called Smart Square that allows us to use predictive analytics to do scheduling. So we basically we use an open shift methodology as a part of Smart Square, and that helps us fill shifts, 75+% more than 2 weeks out. So that utilization of AI is really critical as a part of the value that particular application delivers.
Thank you. And then Christine, we'll go to you next. Adam says that you mentioned sitters. Can the software handle staffing of virtual sitters or virtual nursing?
Yes, thanks. That's a great question. The software can handle staffing of virtual sitters, virtual nursing. We have an entire department. It's our virtual operations center, and we staff out of that unit just like every other unit. They can be set up to do self-scheduling, the hours of the day to meet patient demand, all of the things that the software does for a regular traditional nursing unit can be used in that same unit. And really, I think it works for both if you're looking at, your targets are hours per patient day, or if you have an FTE that's consistent across the board, the staffing will work for both of those models.
Thank you so much. And then Pat, going back to you, Patrick is curious if you offer these tools in a mobile platform for access to data on the go.
We do. We have an array of mobile apps, so you can go and access those through for both Apple and Android platforms, so iOS and Android. And we have that for certainly we have an engagement tool called Passport and Smart Square. Our ShiftWise Flex also has a mobile application as well. So yeah, we're really committed to deploying our applications, not just in a web environment, but also in a mobile environment.
Thank you so much. And then Christine, going back to you really quickly, what retention rates have you experienced with this model?
We actually dropped our retention rates from, I think it was at 24% at the highest, or that was our turnover rate was 24%, and it went down to just over 12% within a period of about 6 to 8 months. Now, there were some other things that went on during that time too. We were able to, meet market rates for nursing in some of the positions that we had, so that helped as well to stabilize the workforce. But I like that you're thinking about, retention, because that's the first piece of kind of making your schedule work the way it needs to, is you need to have a stable workforce, core staff that you're dealing with.
Thank you so much. And then Pat, Christine wants to know, are you using technology, in particular AI-driven, to predict hard-to-fill shifts and determine the right level of incentivization to increase fill rates, particularly within internal workforce in an effort to minimize agency labor costs?
Yes, we are, and so a couple of ways. Certainly, that's integrated into the predictive analytics, or integrated into the scheduling platform, and then the other is market rate data, so that you can start to predict I don't even know if this is a word, but fillability, and maybe some of the dynamics of the ability to fill, how fast, and seeing what sort of variables drive that. So we have the capability to do that in our tools as well.
Thanks so much. And then Christine, going back to something you had mentioned earlier about the sitter and virtual nursing, Mary wants to know if removing a sitter is linked to the MD order in the EHR.
Okay, so the first thing is our MDs do not order sitters. That's the protocol that's driven specifically by nursing. So we took the order set away from the physicians, and nurses really make that decision. If the patient's a suicide risk, then the decision is made based on the suicide score from the tool that we use. However, we do not have that linked up. But now that you said that, Mary, it's a great idea to saying if we could do that, if we could link up that, sitter discharge or discontinuation right into our scheduling software.
Thank you. And then I have another question from Mary for Pat. Is there an industry best practice for determining core to contingent labor, like a head count or a percentage?
I think that's a difficult question to answer straight up because there are so many it depends embedded in my answer. But I think that this is going to be very specific to the individual health system, and I might have mentioned before some of the internal dynamics, but also some of the broader market dynamics and talent availability to determine what the right mix model is. But certainly, one of the things I can say is that almost categorically, our clients have been looking to reduce and rationalize their agency spend further, and that's been a key hallmark. So we've seen usage levels in the pandemic that were above 20% that are now back down around 5, 6, 7%. So you see a big shift in utilization, especially when you get into more optimization and planning.
Thank you. And then Christine, in the revenue cycle management or the back office, other than volume of output, how do you know your staff is working full time? Once they hit a KPI, are they done for the day? Do you have a tool to measure, and how do you compare staff members versus each other?
That's a great question. And really, I think that is kind of hard to manage how that's working, because we really look at how many hours a day is somebody working to determine if they're full-time or part-time, and you're kind of looking at a productivity measure. I think for staff that are probably salaried in most instances. So that's probably the tool that I would use, would be some type of productivity measurement that would measure the output versus hours worked. As far as comparison of staff members versus another, I think you'd have to see, is the work the exact same, and what's the acuity of the work that one's doing versus the other in revenue cycle management. Some of them require more input than others.
All right, thank you so much. And then going back to Christine again. Oh, sorry, go ahead.
I was going to say the only other way really to see if someone is working full time would be, if they're engaged in the whatever software you're using at certain points during the day in that type of situation.
Mm-hmm. Okay, thank you. And then going back to you again, really quickly, have any of these initiatives reduced your dependency on traveling nurses? And do you have like a percentage on that or no?
So yes, I mean, we have reduced travel nurses. I don't know if I can tell you the percentages, but I will tell you at the height of COVID, we were probably at almost 200 travel nurses, and we're down to less than 100 most recently at our organization. And the other piece of it is really working with AMN. We were able to look at the cost of the labor. Every 2 weeks, we met with them and kind of determined what were the rates that were out there in our local area, we're in the greater Philadelphia area, so rates tend to be a little bit higher in our area, but there is a lot of staff around, which is helpful. People want to come to that area and work. So that was really another, I think, win, was driving the cost down and making sure that our partner was looking at that for us as well by comparing to market rates for travelers within our area.
Gotcha, thank you. And that's all the time we have for today. Thank you, Christine, Jana, and Patrick for the excellent presentation, and AMN Healthcare for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thanks for joining us today. Have a wonderful afternoon.